Let me invite Beth Andersen, the president of the California commercial market for Anthem Blue Cross. Beth, come on up. Let's give her a round of applause. So thank you. Thank you for Anthem's support and for your willingness to come up here. You know now, and they may know, that I don't give them any scripted questions. I just say, hey, come on up. It'll be great. And we'll turn on the camera, and we'll see where it goes. So let me start, Beth, first. What do you make in terms of this political dynamic in America today, but in California in particular, where there is all of this verve around Medicare for all, and there is all of this sort of passion and intensity, and we don't really know where we're going, but yet organizations still have to deliver. They still have to be led by leaders who have to have a vision. So how do you lead an organization during this time of political and market uncertainty?
Well, first of all, thank you for having me. And because this is unscripted, it is rather terrifying for me, but that's okay. So I'm really happy to be here. I think that we just need to stay true to our mission, and we need to be very aware of the political environment in which we operate. But I think for myself in leading the California Anthem Health Plan is to focus on access and affordability, and to have that lens top of mind with everything that we do. You know, whether it's small group or individual, I have the commercial sector that I manage, and making sure that when we put out rate increases that the employers see value for what we're providing in terms of services, and that our members see value, and that we serve as advocates for both of them as we work with folks at the enterprise level, and talk about innovation all the time, how we can have access, affordability, and then making sure members get to the right care at the right time at the right place. Yeah. So it's much more personalized, and working across Anthem and the industry, whether it's with our provider partners, sometimes not partners, but most often partners, with the community, public policy, and then even technology, bringing some digital innovations into that space that we've been missing over the past few years. A lot of talk and hype, yeah, but actually delivering them and continuing to iterate on them. And I think showing that and demonstrating that, well, that's always going to be political talk, and especially in campaign election years, buzzwords, yeah, carry the day. But when you get down to it, it's making those things a reality, and then talking about how we're going to finance all of this, and what do folks that are covered, and thank goodness in California, I think the uninsured are only in the single digits. But you can't really take away, in my opinion, the employer-sponsored healthcare coverage, because I think that those employees, our members, there'd be a huge outcry, yeah, and not in a good way.
So there's a lot of attention on Medi-Cal and Medicare, because those are publicly funded lines of business and public regulatory processes, and there's a lot of talk about the individual market because it's got public subsidies. I think one of the more interesting places in healthcare today is the ERISA market, and for good reasons, nobody talks about that. Not public dollars, employers keep those conversations relatively close to the chest. Give us a window into the innovation that's happening in the ERISA space. Is it just PPO as far as the eye can see, or are there employers that are making meaningful demands and driving meaningful change there?
So while there is the PPO as a network kind of construct, and you can have absolute choice, what employers are talking about in that space is the right care, right time, right place, and making sure that they're focused on cost of care and keeping their trends, flat or very low single digits. And so to do that, they want us to better work with the provider community and to offer guidance to members in different ways to meet them where they're at, so that you just don't have free choice. So I can just go to a specialist, even though that's part of the PPO plan design, but that I work with my care management team so that, yeah, they can guide me to the right specialist. And they're looking at models where you might not have to pick a primary care physician, but you're strongly encouraged to do so that they can be not the gatekeeper, but your trusted partner in terms of guiding you through the healthcare system. Because we oftentimes have members that come to us saying, well, I went to cardiac specialist. Now I'm stuck with this big bill, and it turns out I didn't have any heart issue. Well, did you see the primary care physician? You're attributed to one. No, I didn't see them. Well, so it's just educating people, and I think we have a responsibility to better educate folks what that means. So, for example, the emergency room, even though you have a PPO, might not be the best case if you have non-emergent issue, probably the worst place that you can be. Yeah. And then you're left with large bills. So we need to do a way better job of educating those members on where the right care is, whether it's in your physician office, primary care physician office, urgent care, depends on the circumstances, and making those options available to them at the time when they're in need, kind of the moment of intent.
Yeah, so I think it's interesting, there's this attribution experience within the ERISA space that has come from an HMO experience usually, or some sort of delegated risk-bearing model traditionally. Talk about the plan provider relations that you have on the commercial side of the business, and how, providers work generally across all lines of business. You may represent the commercial business. Obviously, Anthem is bigger than just commercial. But how are your plan provider conversations and relations evolving? Because a provider has to do certain things for an HMO payer, has to do other things differently for a Medi-Cal or Medicare payer, so that there's this kind of infrastructure pre-built, or anxiety because of the needs pre-built into your conversations on the commercial side. How are those conversations evolving?
So we sit down to talk. We have a semi-annually planning process with each of our large providers. So we talk about the HMO and how they're doing in terms of managing the care. We also bring the PPO into the equation. And then we talk about different areas of potential innovation that kind of overlays both. So if they have a really great care coordination model that's working well on the HMO, how we can bring that into the PPO and reimburse them for that. And we have different programs that do that. So we try to look at both. But the majority of our membership is PPO based, even though we have a very large HMO population, because employers want both. So we just try to infuse both in those discussions, and then also try to do different pilots to see what might work, whether it's enhancing technology so it makes the providers more efficient in delivering care to members, and whether it's appointment scheduling or telehealth options, things of that nature.
How would you characterize, or what have you all learned from the Vivity experience? Sort of a network-centered approach to care management and cost.
Yeah, and for those of you that don't know, Vivity was founded by Anthem and in Los Angeles, Orange County area, 7 provider groups, and I won't name them all because I'll leave somebody out and that wouldn't be good. But when I first went to my first Vivity meeting, I was amazed at the level of collaboration and dialogue among actually competitors in a very small geographic area. We have really, what we've learned over the 2-3 years that Vivity's been up and running, we've grown the membership a fair amount. We could always grow more. But from a provider standpoint, they're delivering, according to member satisfaction surveys, the net promoter scores higher than our own commercial plans. They are experiencing better quality of care, and we've introduced different ways of caring for emergency room reduction, non-emergency room usage, maternal quality of care, different quality measures like that, and they're all trending in the right direction. So that's a true collaborative partnership, and one that we want to try to take different areas of California.
Yeah. Where does technology fit in all this?
We have been on a stealth, maybe not so stealth mission to build out our technology infrastructure. Anthem was probably a little bit behind. That's my opinion, having recently come from one of the largest healthcare technology companies before I joined Anthem. And I think now we're starting to bring that more to the forefront with providers, helping them become more efficient, helping integrate with their EMRs in a different way. What we don't want to do is disrupt their practice flow, because then technology will never work. It needs to fit in with how they practice medicine and to make it more efficient. At the same time, try to have member tools that connect the member better with their primary care physician and provide more education real time. And I think that to the extent we can do that and capture the moment of intent at the member level, like, am I going to go to the ER, or can I get an appointment with my physician? Where do I get that guidance and bring that to them in an easy way, meet them where they're at, and at the same time then enable the provider to have online appointment schedules so they can see the members and they can see when they're open instead of having them go to emergency room. I think when we combine the two, and that's where we're looking to do, I think then we will start to see more traction in terms of better care, more satisfied members, and less inefficiencies in the system.
Yeah. I know your day job doesn't have political consultant in the job description, but working in healthcare, you got to be pretty politically savvy. In the 2010 Affordable Care Act conversation, business came to the table in a pretty meaningful way and said, we can't keep on with the status quo. Many people credit that as one of the differentiating factors vis-a-vis the 1993-94 reform effort, that business came to the table in a meaningful way in 2009, 2010. Our businesses today, would you categorize them as on the cusp of demanding more action, or are they pretty happy with the progress in the group and the ERISA market? Are they angry and want things fixed, or do you think that they'd like it better? Everyone would like it better, but for the most part, it's doing okay. How would you categorize their
employer groups? You mean?
Yeah.
Businesses? I think that it depends on what size employer you are. I think for the larger employers, they want us to do better. They want us to create more narrow networks because they're concerned, and rightly so, of a recession that's coming, and then there are going to be trade-offs between cost and access, and narrow networks could still be very efficient and provide the right type of experience but be lower cost. So they're looking at that and encouraging us to continue to roll out more narrow network options. I think in the small group, it's still a struggle. Just there's the essential benefits. It's great. There's a lot in there, but still the cost is high, both from a premium standpoint as well as then from a member standpoint, with high deductible health plans that make healthcare access out of reach for many, and so they want different plan designs, and we're tied to having to provide what we're the essential benefits, and so we look at different funding options, like some sort of quasi-self-funded type plan for small employers, and that's what they're looking for. And then in the individual market, it's making sure that we have the right network constructs so that we can provide the most coverage with the least amount of premium cost, even though there are subsidies, which is fantastic.
Was this hard? This was pretty easy, right?
This wasn't so bad.
Yeah. Let's give her a round of applause.
Okay,
Beth Andersen,
thank you.
President at Anthem Blue Cross. Thank you. Great job. Appreciate it.